Good afternoon, everyone. Welcome to from National Press Club, Washington, D.C. My name is Indra Sandal. I'm an innovation specialist at Memphis VA Medical Center, Tennessee, and also 2020 VHA Innovation Fellow. Before we'll start our session, I want to give you a little bit of an overview why we all are here. I'm very sure most of you know transportation is the largest barrier for healthcare access for our 5 million veterans living in urban and rural areas. A 2017 study showed that 1.8 million appointments is canceled by the veterans because of the transportation issues, costing agency $4.4 billion and impacting veterans' care, which they deserve. So VHA is, as you know, is trying their best to provide the best care for the veterans whenever, wherever they need. But then also we see a continuous rise in the missed appointment. So you guys might be wondering what's happening there. And when we talk to the veterans, almost 88% of the veterans mention that they love their VA doctor and they want to come back. And they think that the providers in the community care don't understand the military culture. So the bottom line is that they want to come back. And how we can ensure that we can bring our veterans back to the VA facilities, and the one way we can do is if we can provide them the transportation as easy as raising your hand. So that's how this initiative came up. It's the VHA Uber Health Connect initiative, which is a new collaboration between the Uber Health rideshare services, VHA Innovation Ecosystem, and Veteran Transportation Program Office. It will integrate the HIPAA-compliant technology solution of Uber Health into the VA existing transportation system so that we can create a ride sourcing platform which will allow all the providers in the VA clinics and in the hospital to book a ride for the veterans from the centralized dashboard. This initiative has a 3 importance. And very much I can tell you from the healthcare providers' point of view, it's a lot of reduction in the missed appointment, no-shows, and the late arrivals of their patients. And then patients also going to be having a more adherence to the treatment. And from the healthcare point of view, there will be a potential for the cost saving because there's a decrease in the missed appointments and also the hospitalization and the revisits to the ER. What about the veterans? Because we are doing this for the veterans. And for the veterans, it will be a convenience. And the most important thing is that it will have the positive health outcome on that. So because of that initiative, we all are here. On this stage, we have all the collaborators which are participating in this initiative. And one of the collaborators is our guest speaker, Caitlin Donovan. And she started working with our team recently. Before that, Lauren Steingold, who is the co-founder of the Uber Health, used to work with us. And recently, she handed over the baton to Caitlin. And so Caitlin Donovan is a general manager of the Uber Health. And she joins Uber from MyOrthos, an orthodontic services organization, where she served as a chief operating officer. Prior to that, Caitlin served as the executive vice president of operation at Logistic Care, served as a specialty benefit manager in the non-emergency transportation space. She also served as a vice president of operations at Care Centrics with the focus on home health and the post-acute care. Earlier in her career, she worked in finance as an investor at Bain Capital. She earned her bachelor degrees in economics from Harvard University and lives in Boston area with her husband and 2 boys. Welcome, Caitlin. Stage is yours. Enlighten us with the Uber Health.
Thank you, Indra. And we are so excited for this collaboration and to tell you a little bit more both about Uber Health and the collaboration we have planned with the VA innovation ecosystem. Wanted to talk a little bit about why we formed Uber Health in the first place. And it's very similar to exactly what Indra said you saw at the VA in particular. We saw that there were 3.6 million annual appointments missed because of transportation issues, no-show rates of up to 30%, and a cost to the entire healthcare ecosystem of $150 billion. And we thought that we at Uber could help because we had, through our technology platform, access to a network of independent drivers. and we're doing 10,000 rides per minute with Uber. So we thought it would be really powerful to use that same network and same technology to help solve that real problem in the healthcare industry. Why was there a problem in the healthcare industry? We wanted to make sure to assess that, to ensure that we were adapting our Uber technology to be very specific to the issues that the healthcare industry were facing. So we saw that there were long and unpredictable ETAs that required 24 to 72 hours advance notice for a ride, and imprecise pickup and drop-off times that usually would take about 3 hours. And that adds a lot to a patient's experience. If they are already going to a doctor's appointment that may last for an hour, waiting that extra 3 may be a barrier to care. We also saw that with the networks that existed, driver no-shows were very common, and limited supply relative to demand led to taxi use as a last resource. And so we thought that access to that same reliable Uber network would help close those care gaps. So what did we do? We wanted to make sure to use our GPS to be able to track those ETAs and progress in real time, to identify when suspected fraudulent activity was occurring because we could see where people were. So provided accurate route reporting, cost efficiency, and a complete trip history and analytics. And we wanted to use the power of the network, but again, adapt it for the healthcare use case. So made sure that it was HIPAA compliant. And instead of being through an app where a patient would have to advocate for themselves, we wanted to make sure that care coordinators could arrange rides on behalf of others through our web portal, and making sure that patients could access this without the need for a smartphone or the Uber app, which I'll know we'll talk a little bit more about how that works specifically in our collaboration with the VA in a few minutes. So Indra's so excited to be here and excited to continue the discussion.
Thank you, Caitlin, for such a wonderful presentation. My name is Indra Sandal. I'm a moderator today for the fireside chat. We have on stage our amazing panelists who are going to introduce themselves and give you a little bit of an idea how they got involved in this initiative. I will start with Dr. Patterson.
Hi, my name is Bill Patterson.
I appreciate it.
I am the Network Director and Chief Executive Officer for the VA Heartland Healthcare Network, headquartered in Kansas City. I'm also the mentor for Dr. Sandal in this project.
My name is Garth Miller. I'm the Executive Director of Member Services for VHA, and I also serve as an Executive Advisor for Dr. Sandal.
Good afternoon. My name is Ben Williams. I'm the Director for the Veterans Transportation Program in VHA, and we manage the Beneficiary Travel, Veterans Transportation Service, and Highly Rural Transportation Grants.
Thank you so much, everyone, for joining here, and welcome to this initiative. Let's start the discussion with a very important question, access to care. So what challenges our veterans and VA is facing for the access to care, and what impact does it has on basically on the VA and the veteran? So I will let Dr. Patterson take it, and then from there maybe wrapped up by Mr. Miller.
Yeah, Indra, it's been an interesting history of access in VA, starting in 1952 with General Omar Bradley, who was at that time in charge of the VA, testifying before Congress about the lack of access to hospitals for veterans. Every administration, whether Republican or Democratic, since that time has had an interest in improving access for veterans to get health care through the VA. Various secretaries in the last several years have also had either the impetus or the interest in improving that. After an access crisis was identified in 2014, Congress passed the Veterans Access, Choice, and Accountability Act, known as the CHOICE Act, in order to allow veterans to go to the community if VA care was unavailable. In 2019, a second act called the Mission Act enhanced that and leveraged some of the provisions of the CHOICE Act in order to allow veterans again to go to the community based upon specific criteria. And in some cases, that's because of inability to travel to VA facilities for health care.
Well, that's right, Dr. Patterson. VHA has been working for some time now on addressing access issues and improving access for veterans. And some of the key factors when you look at the social determinants of health, as well as other factors that led to the sweeping changes brought by Mission and by Choice, some of the less conspicuous might be transportation as an obstacle to access for some of our veterans. And there is still a large group of our veterans for which reliable access via transportation is a key component in that access equation.
Yeah, and I think so that maybe the audience might be wondering after listening this thing, that if the transportation is the largest barrier for the veterans and for the access to care for the veterans and the VA, then why VA is not using the rideshare services, and they can use it very much the same way like we use in our daily life. So it might be very interesting to know from Ben, being a director of the Veteran Transportation Program Office, that what's the history behind the rideshare services or the platform which VA might have used, because I'm very sure most of us know that this is not the first time that the VA is going to use the rideshare services. So give us a little bit of a history that how VA used the platform of this rideshare services and what impact it might have on the access to care for our veterans.
Okay. Yeah, sure. Thanks, Indra. I'd love to give a little background. So beneficiary travel and reimbursement to veterans for transportation has been around since the 1940s. Specifically, since then, veterans have used public transportation, buses, trains, and then also taxis as part of those transportation options. Where fast forward to the mid-2010s, when the rideshare started picking up steam and veterans and just the general public started using rideshares a whole lot more, we went to work with OGC to make sure we had the authority, that the rideshare companies were synonymous with the taxi. We received that in 2016, and it became part of what veterans started using more and more as an option for within their beneficiary travel benefits to get reimbursement for transportation. So what we're looking to do now is take it a step further than that and make it a proactive part of how we offer transportation to veterans and make sure that they have the access to the care that they need. So in 2018 is really when we had a few medical centers start using this model or this approach. It's matriculated a little bit over the last couple of years, but one of the outcomes that we're looking to gain out of this project is to build a scalable model that we can work and standardize for how agencies partner with the rideshare companies like Uber Health to make this part of how we approach transportation in general.
That gives us a little bit of an idea that yes, rideshare service does exist and people are using it, but how we can make it more efficient and reliable. So this make me to come to another question, which very often it's asked by so many people when I'm presenting this so many places, that they are not sure whether this is true or not. I'm very sure Caitlin can talk about that, that if the riders don't have Uber app, or if they don't even have a smartphone, can they still take a ride from the Uber Health or any rideshare service? And if the veteran doesn't have phone at all, so give us a little bit of insight that how that whole process works. I'm very sure that's true, but give us the insight from that, and maybe Ben can give an overview, and then Caitlin can talk about the process.
Sure, absolutely. And the short answer to the question is yes. No, you don't need the app, and you don't even need a cell phone. So I'll let Caitlin get into the specifics, but the best part about this opportunity is we're able, as the intro video said, we're able to plug the innovation technology that Uber's created to plug it into how we approach transportation at all the medical centers. So, whether you're a veteran just raising your hand saying, I need a ride, or you're a care coordinator that for a patient that needs a discharge but doesn't have a ride home, we can originate it from using the technology and take it from there. And the veteran just needs a way, a way for us to get a hold of them and or work through the care coordinators that we have. So, Caitlin, if you want to talk about that.
Indra and Ben, I think you said it so well that the short answer is no, you don't need an app. But also thinking about both what the veterans need as well as what the care coordinators need to operationalize this process and leverage the technology, it is so important and part of why we designed the technology this way. So the way the process works, I think, Ben, you alluded to it, we have a dashboard for care coordinators to be able to order rides on behalf of veterans as part of their normal workflow. Think of it as you enter all the same information that we're used to entering in the Uber app, just on a web portal that someone can order for multiple different patients, multiple different veterans in a single place. So then how does the veteran receive that information? There's two different ways. The first is by text message. So you don't need to have a smartphone, you definitely don't need to have the Uber app, but you still receive all the same information that we're used to seeing when we use Uber ourselves. So pickup location, drop-off location, make and model of car, driver's name, all of that information that you need to find your ride and keep you safe. The second way is if you don't have a phone that can receive SMS texts, we can give you all that same information with a landline phone call. So you can receive a phone call. If you don't have a phone yourself, you live in a group home, you can set it up that your group home receives that. And then your care coordinator has the ability to print out all that information as well so that you can have it right in front of you and go to the driver.
Wow, that's amazing. So yeah, it's so good to know the process because people keep on asking, like, yeah, that's true, but we cannot figure it out how it happens. So that's a really good thing to bring it up and then make people, okay, that's true. So yeah, that's really nice to know about that stuff. But Ben, as you mentioned earlier, when we were having a discussion that there are some VA medical centers, not many, who are using the rideshare platform. So I'm very sure you are in touch with them and they might be in touch with the program office. So I might be wondering that how, if they might have given you some insight with their experience when they are providing these rides to the veterans. So do veterans value that the medical facilities are going to take this burden basically on them so that they can provide the reliable transportation to their medical appointment using the rideshare services?
Yeah, no, absolutely. It's a great question. And so far, even with the limited population where it's only been being done at a couple medical centers so far, the feedback is very positive because of the ease of the process. And a couple different parts of, a couple different ways it's easy for them is it's easy to ask for it. It's easy to schedule around it. So there's no, no concern about, oh, I need to schedule the appointment when they may be able to give me a ride. This is an on-demand network of transportation providers, which for the agency, one of the benefits and the value is a diversification of our transportation portfolio. So we have in-source transportation options that we look to and look to mesh and use this option as a way to mesh the opportunities that we can to further provide this service or provide transportation to more veterans.
Wow, that's good to know. And so let's change a little bit a gear and then maybe talk about the most important issue of this era, pandemic, right? Everything is changed, especially the transportation. So in this post-pandemic environment, what safety precautions or the resources does rideshare services leverage to allow veterans to feel very comfortable for their medical appointment if they are transported using the rideshare program? So maybe we can see from a different views, maybe from the VA hospital point of view, and then from the program office point of view, and then maybe Caitlin giving us a little bit more insight what Uber Health is doing it in this post-pandemic era. So I will let Dr. Patterson talk about it.
Thanks, Indra. Those of us on the front line actually providing care to veterans saw dramatic changes due to the pandemic. Of course, VA had emphasis on protecting veterans, their caregivers, and the VA staff during this pandemic, especially when we didn't know so much about this virus and what it might do. As we learned more, we began to leverage different aspects of technology, different ways of delivering care in order to make sure that veterans didn't miss out on care during this time. And so really what happened as an example in VA is telehealth. We'd always used telehealth. I mean, that's nothing new, but what happened is it just exploded so that veterans were getting care in their home. getting care at clinics in a safe manner, but not having to actually do face-to-face and put themselves at risk. That was a real burning platform for change in VA and the way that we think about things. And as we come out of the pandemic and we're beginning to open up a lot more, and in fact, memos have come out in the last 2 days about reopening even more significantly than we have in the past year. We're going to now be faced with how do we overcome other challenges? And transportation will be one of those. And so the burning platform of telehealth, I think, will lead us to the platform that we're going to use with Uber Health in order to make sure that veterans can get the care that they need.
Yes, sir, Dr. Patterson, you're absolutely correct. So that burning platform is definitely there from a transportation perspective. And when we start looking at capacity and limitations to capacity, when you went into the pandemic with the Veterans Transportation Service, which is our in-source transportation network, social distancing really limited the capacity that we had. So enter a massive network of drivers and other opportunities to service veterans and provide their transportation needs with Uber is really how we're working as we come out of the pandemic and continue to open up more to be able to maintain the level of service and make sure that veterans can still get the transportation that they need. So it's really going to provide a critical benefit for us to optimize the mix of how we use and diversify our transportation portfolio.
Sure. And I think thinking about the pandemic, I think everything that you said is right, that transportation and telehealth are an issue. And then I think about the mechanics of how you keep people safe when they're actually riding with one of our independent drivers. And the way that we think about that is in two ways. First is the experience for the veteran themselves. And I think there's a huge benefit to being alone in a car as opposed to with other veterans where you have more exposure just because of the number of people that you're with. And then the second is in Uber and Uber Health's policies for our drivers and how we make sure that we keep our passengers safe. Uber as a company really stands for the safety both of our drivers and our passengers. So you can't become a driver. You cannot sign online without going through an entire safety checklist. And during the pandemic, we actually extended that checklist to include, are you wearing a mask? Do you attest that you're wearing a mask? But went a step beyond that to make sure that they actually were by enforcing that they took a selfie before they even started driving or picked up a passenger. And in addition, we wanted to make sure that our independent drivers had the ability to have the tools they needed to ensure that they had the masks available to them, that they had the hand sanitizer, the things that they needed to keep their car clean. So Uber has spent about $50 million investing in those protocols and provided 23 million masks and other PPE over the course of the pandemic. Which I think goes to all of the goals that both of you were talking about.
Yeah, that's very interesting. And you brought a very good point from the experience point of view, because as we know, this initiative is the most important is for the veteran experience.
Yes.
We are thinking about so many things, but if they are not comfortable taking the ride, we cannot do anything. So we have to have all the things in place and make sure that how's their experience? Are they okay or not? So that brings me to another question, which is very much to talk a little bit about how we are involved and how we are making sure that the veteran experience is taken care in this initiative. So what do you think will be the veterans' experiences and reaction to this initiative with Uber Health? And I will let Garth talk about that, and maybe Ben afterwards. Talk a little bit about the how for this initiative we are collaborating with the other program offices to make sure that veteran experience part is taken care.
Sure. So the value of the veteran experience is, to me, the most important part of this collaboration, and that's why this team is working collaboratively with the Veterans Experience Office to track the sentiment of veterans, the voice of the veterans who are actually using these rideshare programs, and so that we can see. And what we are ultimately hoping to demonstrate is that my fellow veterans and their caregivers see a value in us expanding into the rideshare service lane, pardon the pun, but expanding our transportation into the rideshare service lane, is that valued by my fellow veterans and caregivers, their experience, and we put that right up there with the AAA, which, you know, we're looking at health outcomes. Does it lead to improved health outcomes, overall value, and quality of care, which, as you know, quality of care is directly tied to, are you coming to your follow-up appointments? Are you making it there for preventative health? And so we don't want transportation to ever be an obstacle to veterans reaching their full health potential.
Yeah, I will let Dr. Patterson to add on that.
Yeah, Garth, I couldn't agree with you more. I mean, from the field perspective, the voice of the veteran is important to us as we, again, work through and improve and adapt and communicate back with you and Uber Health on how things are going. And look at this pilot, really develop it into something that can be deployed enterprise-wide. So the voice of the veteran is going to be extremely important for us to know.
Yeah, and that's, I'm very sure a lot of people might be wondering, listening to this thing, okay, you guys are doing the collaboration, started it, what's next? So where this collaboration is. And then, and I want to add one more time on that, that the veteran experience is the most important thing for all the collaborators who are participating in this initiative. So that maybe, let me put that maybe in the different way, that where maybe a little bit talking about this collaboration, where we are, and what's the future for it, where a lot of the stuff happens in the VA and the initiative starts and then it stops. So do we have any future plan for this initiative? Are we moving forward with it? So where we are at this time and what is the future for this collaboration and initiative? I will let Ben to talk about a little bit
Sure.
About that collaboration stuff.
Thanks, Indra. Yeah. So we have launched the pilot, right? So we've launched the pilot in Vision 9 and Vision 15. We've been working for several months to make sure we run through the regulatory hurdles and all of that fun part of the process. And in working with those sites that are out there doing it now to take their process, tweak it where we need to, make it match up with what's happening on the Uber Health side, and prepare those sites that are participating from a pre-launch perspective, and get the POCs lined up and get all the tools lined up to launch. And we're gonna go for 9 months on the pilot, so through next June, and from there the outcome is really going to be focused on taking what we learn during the pilot, tweaking the process as it has been designed to date, and then moving forward with the standard approach across the enterprise.
And what you are thinking about the future? Is it any specific population which we are thinking of targeting, which maybe we will not be able to target at this time?
So I think the great thing is there's, right now it's going to be focused on beneficiary travel eligible veterans, but we're working on other opportunities to expand outside of that, and then also you know traditionally the networks of drivers is more central to urban or metropolitan areas, but the goal would be to collaborate with the rideshare partners to see what we can do to grow the networks into the more rural areas.
Yeah, and that's the most, I think, so challenging thing for us at this time, that how we can implement this thing through the rural population. So I'm very sure Uber Health is doing a lot of the programs and the technology, how Uber Health is reaching out to those people who are living in a rural area. Yeah. And Caitlin also give us a little bit of insight that how you might be thinking in the future to bring those models or the program like for our veterans who are living in rural areas. And that's very important for us to reach out to each and everyone, not only for the urban veterans.
Yeah, I think that's a great point and a great question. And Ben, you said it so well, where I think folks know that for Uber, our technology best connects us to networks in those urban and suburban areas. So that's the perfect pilot case to work out the operational kinks. But we do know that access issues aren't limited to urban and suburban areas. So we are constantly thinking about how can we leverage our technology to solve the complete problem. And we think about that in two ways, especially as we think about our collaboration with the VA. The first is we have other partners that we are working on exposing in our Uber Health dashboard that are more specialized than our network of independent drivers. So whether that's providing higher levels of service, specialization in rural areas, I think that's one potential opportunity for future collaboration. And the second is really around our technology. So our technology right now is used primarily for our own access to our own network of independent drivers, but we do have a way to create closed loops, leveraging the same power of that technology. So a great example of that is in the Vets for Vets program, where we can help use the technology to add that same GPS tracking, good experience for the patient, so that a care coordinator can follow and help optimize the veteran experience, leveraging the existing networks that exist today.
Yeah, that's so good to know that there are some initiative which you can bring it back, and I'm very sure audience might be wondering it might be a long time, but we will see like how the pilot will go and then implement and all that stuff. But we do have plan for the future, not only for taking care of the rural veterans, but also for the veterans who are not beneficiary travel eligible, like Ben mentioned. So this brings us to our last question. By seeing the clock, that I have to wrap up. So the last question, which is for each one of you, maybe in few words, if I'm very sure, because you are part of this from last almost 1 year. I cannot imagine it's the anniversary in October. We are all working towards it. So maybe please explain in few words what you are most excited about for veterans about this initiative. Maybe I will start with Caitlin.
Sure. I'm just so excited to see this public-private collaboration, because I think it brings the best of both worlds. The operations and expertise that you have in serving veterans with the private sector technology. I'm thrilled to see where this goes.
Well, I think this allows veterans who felt like they had to choose care in the community due to either distance or transportation challenges to now have the option through Uber Health to come back to the VA, which we know by many surveys, many of them would prefer to do if they could.
Dr. Sandell, for me, it's that this allows us to pursue our goal of meeting the veterans where they are, literally and figuratively. Meet the veterans where they are, make sure that transportation is not an obstacle to them to getting the care and that they deserve.
I agree with you. How about you, Ben?
So for me, as the program office in charge of making sure transportation is available, for me it's efficacy, not just for the ease of the veteran, but also the efficacy of the process in maximizing the operational component of planning and coordinating the transportation at the facility level. Even though right now the pilot is going to be centered around the network of drivers in the urban and suburban areas, what that allows us to do immediately is refocus our in-source transportation to the rural areas. So it has an immediate impact today and an efficacy all the way around. So that's it.
Yeah, and it's so, I'm like so glad to know all the values which is going to bring it for our veterans, and all the collaborators from the very different angle they are looking into it. Like Dr. Patterson, he's like more overseeing from the medical center point of view, and then Ben and Garth is more from the program office. So, and I'm very sure that most of us, and if I want to maybe give like what's the take-home message for that, we are talking about the veteran experience, we are talking about the access, we are talking about the rural veterans. What's one thing which we all are targeting and which we all are thinking that's the main goal for us? And that is the ease of access to care for our veterans. And whether, like Mr. Miller mentioned, that where they are, can we reach there where they are? So can we provide that ease? And if we can provide that ease to them, I think so the other things which are followed by that, letting them to come there and have the access improved, and also ultimately it's going to have a positive health outcomes. So I think so that's the most important value which we all see in this. It's the ease. So I'm going to wrap up now with this conversation, but before that, I owe a lot of people a thank you, and I do have time to do that. So I want to express my sincere gratitude to our panelists and our team and all the medical center directors and the transportation services in both the Vision 9, which is a Mid-South network, and also Vision 15. And a special thank to Ms. Genevieve, who is leading from the Vision 15, and John Griffins, who is leading from Vision 9. And the executive leadership of VHA Innovation Ecosystem, Executive Director Kit, and Susie, who is the director of the fellowship program, because this project is my fellowship program, and if they might have not given the opportunity, we might not be here on the stage for this initiative. And beyond that, Hill leadership, Dr. Vega and Dr. Clancy, by seeing them, I started my career in the innovation. And last but not least, my supervisor, Medical Center Director of Memphis VA Medical Center, Mr. Dunning, who is not here today, he's a big supporter of innovation, and my family, which I cannot forget, VHA Innovators Network. So before we all sign off today, I have a special guest who cannot come here, but he sent his small message for all of us, and I will let you see who is that.
Hello, good afternoon. My name is Greg Goins. I'm the current interim director for Vision 9 and normally the permanent facility director in Lexington, which is also in Vision 9. Andrew, thank you for having me. I would love to be there in person to celebrate the innovations that are happening throughout VA, certainly in collaboration with the VA Innovation Network. I'm excited to talk a little bit about today the VA Uber Connect initiative that's happening in Vision 9 and in Vision 15. Here in Vision 9 we have a wide diversity of demographic as far as geography. When you look at the state of Kentucky and the state of Tennessee, we have lots of urban environments like Louisville or Nashville or Memphis, but we also have lots of environments that are highly rural, which creates a lot of challenges for transportation for our veterans. We're very excited to welcome this initiative in Vision 9 as well, Vision 15. This is a demonstration of a great collaboration through the VHA Innovation Ecosystem, the VA Transportation Program Office, and Uber Health Initiative. We hope to accomplish a few things with this. If you haven't already heard this, we look to see a reduction in no-shows. Obviously, we look hopefully to see a realization of cost savings because we're going to minimize the reimbursements that happen through mileage and some of those things that we do for our veterans currently. But we also hope to see, most importantly, an improvement in health outcomes because of availability to healthcare that currently we can't reach veterans with our existing transportation programs. Although all those things are really beneficial, the greatest thing about this initiative is the ease of access it creates for transportation with our veterans. Not only can the veterans tap into transportation in spaces where they currently can't do that, it also creates a much easier process because there is no upfront cost to our veterans, and Uber Health does a lot of the work up front for us, which obviously is a great thing for our system. This is a great initiative for VHA, but certainly for Vision 9 and Vision 15 as we collaborate through the VHA Innovators Network. Thanks for having me, Indra, and again, sorry I can't be there in person, but I hope you have a great event, and I look forward to seeing it virtually.